Hey everybody, live from the Hive, I'm Dr. B, and this is the buzz on unusual colors in a newborn's skin. So today's talk is about two color change issues in newborn skin. The first one we're going to talk about has to do with a harmless blood flow issue that makes the skin rapidly turn red or turn blue. And that's actually harmless, believe it or not. The second issue we're going to talk about is an orangish color that the skin can turn from a chemical in the newborn's blood. Let's talk about blood flow issues. Now, these are really, really interesting, and they occur because the body can shut off blood supply to different parts of the skin to try to manage the temperature. First, what we have here is a Harlequin color change. Harlequin, kind of like Harley Quinn in the superhero movies, because she's a Harlequin. She wears red on one side, black on the other. Well, here you have a Harlequin color change. Half the baby, or sometimes just mottled areas, turn red. And it's usually the areas that are dependent, meaning that the lower part of the body. If the kid's laying on his right side, it might be the right side that turns red. This child actually has some pale areas in the arm and the leg. You see the rest of him looks red. This is completely harmless. Here's another example. This child was probably laying on the right side, and the right part of the face turns red. If you see this, do not worry about it. This is from just a temperature regulation issue or from laying on one side. It is completely transient. It's going to go away, and it doesn't mean there's anything wrong with their heart or with their vascular system, with their blood vessels. This is a picture of a child with Cutis marmorata. Cutis marmorata, they have this kind of, you can see on the legs, this kind of webbing or mottling. This is not like cyanosis because there's a heart problem. This is just, again, another blood flow issue. Usually this is because the child's a little bit cold, and warming up the baby should make it go away rapidly. If it doesn't go away, then you want to talk to your doctor about this. There are more persistent forms. Cutis marmorata, telangiectasia congenita. It's a long word. We don't see that very often. I've seen 2 cases of that ever. But this is just regular, good old Cutis marmorata. Warm them up, and it should go away. Now this here, I couldn't find a great picture in a baby, but just pretend this is a very large baby. What you can see, this is obviously an older child, but this does happen in newborns very often. The hands and the feet will turn blue, and it looks like they're wearing blue gloves or socks. This is called acrocyanosis. And this, again, this is a blood flow management issue. You warm up their hands or their feet, it's going to turn back off, and it's going to turn pink again. Completely harmless. Acrocyanosis. It's actually really interesting when we see it, but again, it's not going to do anything, and it doesn't really mean anything. And now we've come to our final skin problem or skin issue. We've talked about the color red. We've talked about the color blue. Now let's talk about an orange-yellow color, the color of newborn jaundice. This baby looks like he's just about had enough. He's a little leery. Just about every baby, not every baby looks this angry, but just about every baby does get a little yellowish looking, and that's what we call jaundiced. Jaundice is from a natural chemical in the blood called bilirubin. And normally the liver manages that chemical, but the liver in newborns doesn't do that job very well. And so what you'll see is that bilirubin level, that chemical, will build up in the blood, and that'll make the baby's skin and the baby's eyes look kind of an orange yellow, like this baby in the photo. What you want to do in this case is make sure that the baby is eating very often and pooping a lot, and it shouldn't be a problem. In fact, when the baby's poop turns yellow in a couple days, that's the jaundice coming out in the poop. So when we see that transition, we feel pretty good about this, that this baby's going to not be yellow for that much longer. Sometimes the bilirubin level can get a bit too high, and the baby has to undergo phototherapy. And here's another baby just kind of chilling out. You put the things over the eyes, the little blinders over the eyes to protect the eyes from UV radiation, which comes from the bilirubin lights. And what happens with that bilirubin is it gets broken down by these lights, and then they can pee it out very easily. Keep in mind that breastfed babies can be yellow for a long time, sometimes for months. And the last place you're going to see that yellowness go away is in the eyes. So don't worry if you see a healthy, good eating breastfed baby that looks yellow for a little bit longer. Talk to your doctor if you have concerns about that, but generally it doesn't mean much of anything. Well, sadly, that is our final lecture on newborn skin problems. If you have any questions about your newborn skin, please ask it in the comments below. The next topic we're going to talk about will be circumcision care and umbilical cord care. Don't worry, we're not going to have any pictures of circumcisions. We will have some pictures of umbilical cords though. Thanks for watching. Please subscribe if you like what you see, and we'll catch you next time. I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. Bye-bye.